Now, bipolar is thrown around like water. You've got bipolar, I have bipolar. If I'm up today, I'm manic. If I go home tonight and I'm depressed because I'm tired, that shows I have bipolar disease. It's a lot of hokum.
With so much money to be made, all psychiatrists needed was a scientific theory to justify it. Their solution? An official report declaring that all mental problems derive from a so-called chemical imbalance in the brain, requiring drugs to correct.
This chemical imbalance is one of the greatest fallacies ever foisted upon patients and the public. There is no chemical test to show an imbalance related to any psychiatric disease, whether it's depression, anxiety, what have you.
The chemical imbalance is for the benefit of the psychiatrist. It has to be there so that psychiatrists can treat it.
Yeah, I see a lot of things on television about bipolar.
Bipolar? You know, they talk about bipolar a lot.
My oldest son was diagnosed with bipolar.
Bipolar, I've known a lot of bipolar.
Two friends from both of them were like diagnosed with bipolar.
Some people I know that are bipolar.
My neighbor, she was bipolar. I was diagnosed with bipolar.
My mother had bipolar.
He was actually bipolar.
Schizophrenic bipolar. Bipolar and obsessive compulsive.
Bipolar and ADHD.
Bipolar disorder.
Bipolar, yeah.
Bipolar situation.
Bipolar. Bipolar.
Bipolar.
Bipolar.
Bipolar.
There's 3 personality disorders, and then the most recent is bipolar. And that's just been in the past year.
Spearheading the popularizing of bipolar disorder, especially in children, is psychiatrist Dr. Joseph Biederman, a paid speaker, advisor, and researcher for 25 different drug companies.
In 1996, the drug companies funneled all this money to this Dr. Biederman. He's well known. He's the one that came up and said that there's bipolar disorder in little kids. This was unheard of. There was no bipolar disorder in any kids. He came up with the study and published the articles out all over the world, and other doctors followed his lead that bipolar is in little kids.
Due to the constant promotion by Dr. Biederman and his colleagues, there has been a 4,000% increase of the diagnosis of bipolar in children since 1994, while the number of antipsychotics prescribed to them has leaped 5-fold to an estimated 2.5 million prescriptions. In 2008, Dr. Biederman was exposed by a Senate investigation for failing to report $1.6 million in personal income from pharmaceutical companies. But the damage had been done. Because of the bipolar fad created by Dr. Biederman, antipsychotics, some of the most powerful psychotropic drugs being prescribed, are psychiatry's drug of choice. The top 3 best-selling antipsychotics together gross $25,000 every minute. And no matter how big the psychotropic drug industry gets, psychiatrists are hard at work providing the diagnoses to make it even bigger.
A lot of the pharmacology of these medications, they don't even know how they work in the first place.
But it has been noted that there is one primary side effect of psychotropics that is common to all.
Most medication and psychotropic medication, I've noticed, tends to flatten things, so that while you're decreasing the depression, you're also decreasing the joy. And so you're minimizing what it means to be human in the service of avoiding dealing with a problem.
They can't connect to the world around them. They feel like there's no feeling, which is, you know, you should have some feeling there.
All that's doing is really numbing them down, and they're not doing the work that they need to do to resolve that issue that's going on somewhere internally.
And it was found that many times when you stop these drugs, the symptoms don't disappear. You think the shaking is going to go away. It may not go away. And there's nothing more devastating to a young child than to twitch and have these jerks in their body that they can't control.
The most horrendous may be an intense inner agitation and restlessness, known as akathisia.
These drugs can cause something called akathisia, which causes people to become very agitated, and actually a little nuts, you know, a little off balance. and they'll do things that they never would have done before, things that are totally out of character.
This is a normal person without any history of auditory hallucinations, and all of a sudden they'll say there's voices telling them this is the only way to stop the pain, it's the only way is to kill themselves.
Had patients tell me that they never, ever, ever had one single thought about suicide in their entire life until they started on the drug.
Typical antipsychotics, such as thorazine, are powerful chemicals originally designed to shut down the central nervous systems of mental hospital inmates. They are now mainly used on people with serious mental problems, and they can cause feelings of helplessness, deterioration of the mind, neurological damage, dementia, trembling, twitching, and damage to internal organs, to name a few. Atypical antipsychotics, one of the newest classes of psychotropic drugs, are used mainly on adults and children diagnosed with bipolar disorder. They are also known as mood stabilizers. Though launched with storied claims as miracle drugs with little or no side effects, atypical antipsychotics have recently been exposed as creating severe weight gain, diabetes, coronary heart disease, acutely irregular muscle movement, pancreatitis, and delirium. Though the new antipsychotics were originally approved only to treat schizophrenic adults, over a 7-year period, prescriptions for children jumped 5-fold to an estimated 2.5 million prescriptions. And this drugging is coming with serious consequences.
You know, I've seen kids who have had significant weight gain on some of the antipsychotics, where they were pre-diabetic. You know, they've had, changes in some of their cardiovascular functioning. So there are potentials to really damage the child's health.
When you get drugs that you're giving to kids that we know cause extreme weight gain and attack the liver, attack the kidney, that have long-term results, these children that we're giving them today, this medication, we may be doing, kidney dialysis for in 10, 15 years.
And it is not only children that can be affected.
And that's a neurological syndrome where you have muscle twitches, abnormal jerks, which are uncontrolled, and they either last for a long time or sometimes they're permanent. So that's very clear, very well recognized, long-term or permanent brain damage from these medications.
Mr. Blount has virtually no signs of his original illness now. The signs that the movements of his mouth are completely side effects of the drugs that he was on for 20 years. Mr. Blount is quite rational. He understands what's going on. And if you're patient, he can carry on a very rational conversation with you.
Even when you remove the drug, it may still remain. It means you have caused a permanent disabling of the brain. In the late 50s, you get the first signs of it, people starting to worry about it. But it's not until the late 70s that psychiatrists start warning their patients about it, 20 years.
What about those who say psychotropic drugs really did make them feel better? That for them, these are life-saving medications whose benefits exceed their risks. Are psychotropics actually safe and effective for them?
So what ends up happening is that someone feels good for a while, and then very often they have to have their dose increased, and then they feel good for a while, and then they might have to have it increased again, or maybe they'll switch agents. So it's that kind of a story if you're not actually getting to the root of what's going on.
I think the research is pretty clear that then all of a sudden starts to change, and you start to have a supersensitivity to being depressed, in which case then they become more depressed, and then they're chronically depressed.
And there is ample evidence that if the short-term side effects of psychotropics don't get you, the long-term effects will.
Psychiatric drugs are toxic to the body. They do build up in the body and add to the body's reserve and reservoir of toxins that will suppress the immune system, and the body will try and fight them as foreign objects.
If they're on these medications for years and years and years, I mean, one of the things that we know about adults and some of the, for bipolar and schizophrenia is that they're dying at younger ages, and these are adults. So if we're starting this medication approach with young kids, what is their life expectancy going to be?
No one's really examined it or is looking at the big picture, which is what's it really do to a society with a proliferation of mood-altering, emotion-altering, or blunting in a society at large.
And I think we're going to really see a huge, huge increase in violence and suicide and a lot of bizarre behaviors that we haven't seen, because for a very short period of time, only in the last 60 years, have we really started medicating, intoxicating our brains with these incredibly toxic substances.
The very real probability of significant long and short-term side effects should give anyone considering taking psychotropic drugs great pause. But what about those already taking them, who, no matter how hard they try, cannot get off?